Let's take some time to talk about high-definition liposculpture, or something that people call high-def lipo or HD lipo. This is a really different approach to the modern liposculpture that we see in plastic surgery. The differences between modern high-definition liposculpture and traditional liposculpture are really, truthfully, more of a respect for the anatomy. What is high definition, or what is definition in general? Well, it's the use of liposculpture to highlight the natural shapes and lines of your body. Not all patients are candidates for high definition liposculpture. Many or most patients are more of a candidate for medium definition liposculpture. In women, that means preserving the feminine quality of their abdomen, but providing an athletic improvement. Improving the line down the middle and the lines down the sides, but not necessarily showing all the lines between the abdominal muscles. Patients that are candidates for high definition liposculpture are patients that are very fit, that live an active lifestyle, and that want to show additional accent to their body and additional lines and shapes and hills and valleys in order to improve the quality of their already athletic physique. In those patients, we can carve out the lines between the abdominal muscles in order to really etch out a strong shape to their abdominal core. And you can show the definition and lines along the hip that lead down towards the groin area to improve the contours. Almost everybody wants to have a flat stomach, at least a flat area between the belly button and what's below. And that can be achieved in different types of lipo-abdominal sculpture. However, with high-def lipo, you can really etch out those areas to not just show a flatness and to remove fat, but to accentuate the muscular and anatomic structure that's below. Now, what are the techniques and tools and instruments that go into this surgical procedure? Well, there's a traditional approach to power-assisted liposculpture. There's also energy-based devices that can tighten the skin and change what happens on the inside to further improve the quality of the result. There may be a combination of grafting of some of the fat that we take out to accentuate some of the other structures that you see. Now, how do you know if someone's trained well to do this, or how does somebody learn how to do high-definition liposculpture? Well, there really are some experts in the world for this technique. One of them is an expert from Colombia, and he gives courses around the world teaching surgeons how to partake in this type of surgical procedure. That's who I trained with. That's where my surgical technique comes from Dr. Hoyos down in Colombia. And in those courses, they teach you a lot about abdominal shape and anatomy, but also the technology that goes into it. And I bring that training to my patients. So I say, let's talk about the athleticism that we're trying to generate. I offer low, medium, and high definition liposculpture to patients. And then we sit down and talk about what are realistic expectations for your body over time. Again, most patients are going to be in that medium to high definition category, but when we're going for true high definition liposculpture, it's important to sit down and talk about these different approaches and how we accentuate your natural anatomy to show a truly athletic and defined physique.